Medical imaging is a technique used to create visual representations of the interior of a body for clinical analysis and medical intervention. It also allows for the visual representation of the functions of some organs or tissues. In 1895, the first Nobel laureate, physicist Wilhelm Conrad Röntgen, described a new type of radiation, X-rays. This catalyzed a new medical specialty of radiology, along with the medical imaging industry. At first, these radiographic imaging systems were rudimentary, as they only provided images of broken bones or contrast-enhanced structures such as the urinary or gastrointestinal systems. However, advances in imaging techniques have progressed the application of radiographic imaging techniques in medical diagnosis. Magnetic resonance imaging, MRI, also provides detailed anatomic information without using ionizing radiation. MRI senses the spin of a person's atoms when they are placed in a large static magnetic field. These static cross-sectional images of the body, which are produced, include both bone and soft tissue. They are often used for pre-surgery planning and to diagnose cancer. MRI uses powerful magnets to polarize and excite hydrogen nuclei of water molecules in a human tissue. This produces a signal that is spatially encoded and can be detected, thus producing images of the body. The MRI emits a radio frequency, RF pulse, at the resonant frequency of the hydrogen atoms on water molecules, and there are radio frequency antennas which sends this pulse to the area of the body which is being examined. This RF pulse is absorbed by protons, causing them to change their directions due to the magnetic field. Once the RF pulse is turned off, the protons relax and emit radio waves in the process, which is detected. This radio frequency emission from the hydrogen atoms on water helps construct an image. The Larmor frequency is the resonant frequency of a spinning magnetic dipole and is determined by the strength of the main magnetic field and the chemical environment of a nuclei. MRI uses three electromagnetic fields. One is a very strong static magnetic field, which is used to polarize the hydrogen nuclei and is called the primary field. The second is a gradient field, which can be modified to vary in space and time for spatial encoding. The third is a spatially homogeneous radiofrequency RF field, which can assist in the hydrogen nuclei's production of detectable signal, which is then collected through an RF antenna. Unlike X-rays and computed tomography, CT scans, ultrasound imaging does not involve any ionizing radiation, and thus is considered to be non-invasive. Furthermore, it provides real-time diagnostic information about the mechanical nature and motion of soft tissue and blood flow. It is also portable, easy to use, and low in cost. Medical ultrasound uses high-frequency broadband sound waves that are reflected by human tissue to varying degrees. This helps produce up to 3D images. A common use of this is to produce images of fetus in pregnant women. Few other important uses include imaging the heart, breast, muscles, etc. Despite its provision of less anatomical detail compared to CT scans or MRI, it has several advantages. These include the fact that ultrasound imaging emits no ionizing radiation as mentioned before, and contains speckle that can be used in elastography. Elastography maps the elastic properties of soft tissue and can distinguish between healthy and unhealthy tissue for medical diagnosis. Ultrasound is a little different from other medical imaging modalities, as it works through the transmission and receipt of sound waves. The high-frequency sound waves are sent into the tissue, and a signal will be reduced and then returned at separate intervals. These signals depend on the composition of the different tissues. The real-time moving image which are created can be used to guide drainage and biopsy procedures. Additionally, a Doppler radar is used in modern scanners to assist in analyzing the blood flow in arteries and veins to be assessed.